Today on Clubhouse Gas, we're talking about medial tibial stress syndrome. Yeah, I don't know what that is either. Today I'm back with friend of the show, Dr. David Marshall, Director of Sports Medicine over at Children's Healthcare of Atlanta. Welcome back, Dr. Marshall.
Thanks for having me.
Thanks for being back. All right, so I've been running a lot lately, and my shins have been killing me.
Yeah.
And I'm hearing this term all the time, shin splints.
Right.
I don't even know, how do I know if I have one? Help.
Yeah, that's a very common ailment that we see amongst runners. There's a lot of things that can cause shin splints and a lot of things that you can do to try to prevent it or treat them when you do get them. First of all, I don't like the term shin splints. I think it's overused. It seems that too many athletes, too many coaches, too many healthcare professionals are using the term shin splints to name any ailment from the knee down to the ankle. Oh, if your leg hurts, it must be shin splints. But there's a very specific problem that causes the classic shin splints. I like to use the term medial tibial stress syndrome. It's much more descriptive for the location of the pain and the cause of the pain that causes the classic shin splints.
People aren't going to overuse that word.
No, they're not. MTSS, that's a lot easier to say.
Okay, so what are some of these main symptoms?
Well, the main symptoms of shin splints is pain, and it's usually pain with running. It is one of the classic examples of an overuse injury, where the training or the abuse of training on a part of your body outpaces the body's ability to heal itself. And that's kind of how we train. That's how we adapt to stresses. You break down your body, you stress it, and then give it ample time to repair itself. When it does that, you could slowly, over a period of time, increase the stresses. What happens with overuse injuries such as shin splints, the abuse of training or the beating up on your body outpaces the body's ability to catch up, and as a result, tissue fails, and that's what causes the pain. So the most common symptom is pain after exercise, sometimes during exercise.
So you started telling us about the shin splint. Tell me more about exactly what happens, though.
Well, there's a lot of talk as to what actually causes the shin split. My understanding and my belief is it's little tiny microscopic muscle tears, believe it or not. On the inside edge of the shin bone, which is the tibia, that's the flat bone on the front of your leg, the one that you bang into the steps all the time if you try to go up too fast and miss. It's called the tibia, and the inside or the back edge or the medial edge of the tibia, about half to two-thirds of the way down, there's a muscle. One of your calf muscles called the soleus attaches to the shaft of that bone. Next time you guys have turkey legs or drumsticks or chicken wings, you notice that the meat doesn't attach just to the ends of the bones. There's that deep layer of meat that attaches to the shaft of the bone. Peel that deep layer of meat away very slowly, and you'll see those little tiny fibers, those little tiny microscopic muscles as they attach to the bone. That's where shin splints occur. So if you run too much, if those muscles are too tight, if you run on the wrong terrains or poor shoes, those little tiny muscles will start to peel away from the bone, and that's what causes the pain. So it's little tiny muscle fibers that get peeled away or tear microscopically from the bone. Risk factors for shin splints: number one, pure mileage, pure volume. If you start off running too much and you increase your mileage too quickly, that can overstress your body. Even though you have perfect shoes and perfect technique and perfect terrain, too many miles can certainly cause it. Other biomechanical issues are flat feet, sometimes turn pronation. If you stand and your arches collapse, that puts a lot more pressure, a lot more weight or stress on the inside edge of those legs, exactly where that muscle attaches. So the kids that are pronators or the runners that collapse their arches somewhat, they can be at increased risk of shin splints.
What do you think about the special shoes for those?
Well, there are special shoes, and there are shoes for pronators. If you go to a good running shoe company, there's a lot of them in Atlanta, Fleet Feet, Fidipides, Big Peach Running, even places like Foot Solutions or a New Balance store. Those people know shoes and they know the needs of different feet. So if you go to a place like that and they deem that you're a pronator, there'll be certain shoes or different lines of shoes that you need to buy. If you buy a shoe for a supinator, which is the opposite, or buy a shoe for the neutral foot, you might be doing yourself a disservice.
So how do you know what kind of shoe you need?
I would go to, a good running shoe company where the people that are there not just to sell you shoes, but to sell you the right kind of shoes. So some of these places will have evaluations. They might have you run on a treadmill. They might have you stand on a computerized platform that determines where your foot needs the pressure, where it needs the support, where it doesn't, and then that computer will help determine what type of shoe or what type of extra insert that you need to put in your shoe if that's the case.
Okay, so you said increasing your workout too quickly, wearing the wrong shoes. What are some of the other?
Yeah, you can look at the surface that you run on. Very hard concrete asphalt type surfaces compared to a rubberized cushion track at the high schools, a wood chip or a grass cross country course. Those are better than the hard surfaces. Even the treadmills. The treadmills nowadays have cushioned shock absorbing decks, which are designed to decrease the stress going through your legs when you hit. Look at the terrain that you run on also, the inclines. Here in Atlanta, sometimes neighborhoods and places where we run are very hilly. So running up inclines and down declines can increase stress on your legs as well. So try to keep your running on level ground with a nice surface and good, properly fitting shoes. Look at the mileage on the shoes too. We recommend that shoes should have about 350 to 400 miles on them. If you start getting over that, then it's time to get new shoes. And some of the kids that run, 30 to 40 miles a week, it might be 2.5 to 3 months, and they have to go back and spend, another $120 on a pair of running shoes. So it can get pretty expensive. But so can doctor's visits.
Right, money well spent. Okay, so say that our viewers are tuning in, it's too late. They already do have the shin splints. What do they do?
Well, the first thing I do is back off on your training. Very rarely does an athlete have to stop all training. There's a term that we like to use called cross-training. Even though we're going to really back off on their mileage on the road, they can still cross-train. They can still put in the same aerobic workout, but a much less stressful workout, such as a stationary bike, elliptical machine, rowing machines, even swimming. Those are all good aerobic workouts that cause much less stress on the shin. You got to ice it. I like ice cup massage. You can take some styrofoam coffee cups and fill them to the very tippy top with water and freeze them. And then peel back an inch of the paper around the rim of the cup. Then you have this nice little frozen snow cone like a push-up pop that we still enjoy. And you can do some massage down all along that painful area. I think that's more effective than just putting an ice bag on the sore spot.
Wow. Now, how do you know when it's time to get back to your regular workout?
Well, I think when the pain subsides, you don't have any more pain at rest, you don't have any more pain with these lesser impact workouts, then I think it's okay to go ahead and get back on the road. I'd really cut it back. Maybe do about 1/3 of what you normally would do and see what happens. If that reproduces the pain, back up or back off some more. If you can tolerate that, then every week increase about 10%. That's the ramp up that we typically recommend. No more than 10% mileage per week. If you do more than that, you're really putting your bones at risk. When an athlete comes the second week of cross-country season and says, I have shin splints, that's a tough one to treat because they're early in the season, they don't want to stop, they need to continue to train. And a lot of times mild to moderate shin splints isn't bad enough to make them stop, but it is bad enough to nag them and bother them the entire season. So really, what they need is an off-season. They need a good 4 to 6 week period where we can really back off on the mileage, and sometimes that's not always possible.
Well, Dr. Marshall, thanks for teaching us about medial tibial stress syndrome.
Shin splints.
How to do. All right, that works. Thank you so much and for all you do to help the kids.
My pleasure.
All right, and thank you for watching this edition of Clubhouse Gas. We'll see you next time.